Okay, so today we'll be focusing on carpal tunnel syndrome with one of my clients. What's your name? I'm joking. Gio. Her name is Gio. She's an esthetician, local in Beaufort, Georgia, but she works a lot with her hands. So today we're focusing on her neck, shoulders, forearms, and hands, fingers. Also, yeah, what'd you say?
I said, yes, Lord.
Yes, Lord. Right. So also, I'll give you a paraffin wax treatment for your hands. Okay. Just a little extra thing that I like to put into a stretch session if the person needs it. So we're going to start off with a test for carpal tunnel syndrome. And the test is two tests, actually. The first test is going to be the phalanx test. And then the second test is going to be the carpal compression test, also known as Durkin's. Now, the phalanx test, pretty much, we're going to bring the wrist into flexion. We're going to hold it for 30 seconds to a minute. And what we're looking for is tingling, what else? Numbness in the fingers, radiating pain up and down the arm. So if you feel any of that while I'm holding this, all the way up to your elbow, yeah. Right? And actually your elbow is a little bit flexed. I'm going to bring that elbow into extension and then flex this.
It's not like the worst.
Okay. Gotcha. So if they feel any of those sensations, they test positive. Now, are we saying that you definitely have carpal tunnel syndrome? No, but there could be a possibility. So I always recommend for them to go to their physician and get a positive testing.
I trust Elisa.
Okay. So she tested positive on that side. You're going to just relax right there. And I'm just going to test the other side. Flip. And then bring that wrist into flexion. Also, when you bring the wrist into flexion, I want to hold the middle part of your middle finger.
Yeah, this side has pretty much like no range of motion.
Gotcha. Well, this is your right side, so this is the side I use the most. It's going to be a little bit more tighter. Any type of tingling, radiating?
Kind of, yeah, I can feel kind of the same.
Okay.
Thing I felt on the other side.
Both hands.
Yeah, this side's worse because I play guitar.
Oh, boy. All right, so the Durkin's test pretty much is we're going to put pressure on the carpal tunnel itself. So that's right underneath or right on top of the carpals. Yeah. And we can hold this for 30 seconds, 2 minutes. And I'm right in the crease of the wrist.
It's so weird because it's like, it doesn't hurt, but I can feel the start of hurt.
Gotcha.
Like if I had to explain it.
And I'm putting direct pressure onto the nerve itself. For you, only 30 seconds because you already felt it. And then I'll test the other side. So, moving forward, I know that I'm going to have to put you on a program for, I always start everybody off with 3 months for carpal tunnel. And within that program, I'm really going to focus on your neck, your shoulders, your arms, biceps and triceps, your forearms, both anterior and posterior. Definitely your hands, because you gotta remember your nerves go all the way to your fingers. Mm-hmm. But the main focus are going to be your forearms and your fingers. Okay. Now we're focusing on stretch. So First thing we're going to do is mobilize the shoulder. I like to come under right here. Bring that shoulder into rotation right there. Already seeing a restriction in already seeing a restriction in that external rotation of the shoulder. It's mostly in her scapular region.
That's what that is?
Mm-hmm. That's her scapula.
Hurting so much. And I didn't know it started from my arm.
Oh my goodness. Yes. So I'm going to mobilize shoulder right here.
That's crazy how it all is connected.
I want to support under her shoulder and just mobilize. Nice rounding motions. I already feel the muscles trying to relax. Gentle, wide stance and dance with it.
I love it. Don't become an esthetician unless you can afford to come see it.
And I'm putting pressure on the medial border of the scapula as I mobilize. And at the spine of the scapula, putting pressure right there as I go down. She has a lot of tension up here in her upper traps. Nice. We're going to go into rotation. So putting a little bit of pressure right here in the joint of the shoulder, and then rotating her forearm up. And that's all she can give me. So that is limited rotation. What I want you to do, we're going to add a PNF cycle. Come down, rotate down, wrist down, elbow up. Let it go. And she's a little bit weak in that position. I barely got a compression. So I'm going to change the range of motion to about right there. I want you to rotate down towards the floor for me. Let it go. So definitely going to also focus on her thoracic outlet, which is her pec minor, scalings in the neck. So anterior neck, we're going to have to focus on that too. Just going to open up that chest wide. Deep breath in, exhale. Start with some pec stretch. Bring it right here. We can shorten that if they're really tight right there. Bring your arm in. And then inhale for me. And then exhale, I'm just going to stand straight up. Open up that chest. I want to add a PNF cycle right here. Press your elbow down towards the floor for me. And let it go. And then I'm just going to mobilize.
It feels like I haven't used this part of my arm forever. This is crazy.
And create some space in the joint. Mobilize. Make sure you hold your stretches at least 30 seconds.
Okay. I will say some mornings I definitely don't hold it.
Yeah.
I do it every morning.
We're going to open up the chest again.
The stretch that you have me do at home, that's also going to open up what you're working on right now.
Thoracic, yeah. So this is a really good thoracic opener that I'm about to show you. The table is kind of high because she is so small, but I want to bring her down just a little bit so that I can have a little bit of leverage on this stretch. So for me, I like to bring my knee right in the crevice of the hip, pretty much where the iliac crest meets the QL or the obliques. Okay, we're going to add a rotation. Bringing my hand underneath that shoulder, my other arm right here. I'm going to ask for you to breathe in for me. And exhale. And we're rotating. Now for her, any type of spinal rotation is going to help open up her thoracic because she does have scoliosis. So spinal rotation is really good for people who have scoliosis. How has that been feeling? Now that you're doing more thoracic openers and stuff like that.
My back itself is a whole lot better. I still think I need a little bit, like another stretch for my left hip.
Okay.
Because the arthritis in that side is just so bad. But otherwise, like, my actual spine has been great.
Gotcha. That's good. All right.
I don't even think I'm gonna go back to that spine doctor. Because I just think the injections are so unnecessary.
Gotcha. Yeah.
Fire y'all's doctors. Come together.
So now that we pretty much opened up the chest, relaxed a lot of this upper trap. I'm going to work on it more once I turn you over. I really want to focus on her biceps. So main focus is going to be anterior part of the arm. So we're going to go from pecs, anterior deltoid. I'm kind of grabbing that muscle. And then I'm just going to mobilize it as I put like a grab pressure or compression on that muscle. Straighten out the arm. Rotate up. Rotate back. So getting it in this short position. Oh, there you go. And long position. And then I'm just going to grab her biceps. Not much to grab, but I'm going to grab it. And then extend the elbow. Grab and extend. So it's pretty much like a pin and stretch. If you're familiar with pin and stretch. I'm going all the way down to the elbow. Her biceps aren't that tight, so I'm not going to do any type of tendon work. But if they have tendinopathy in the bicep, start with the origin point of the bicep, then come to the insertion point in the bicep, and then do compression and extension. Okay? I will work on the forearm once I turn her over. So I'm just going to repeat what I did on the routine first, just to get the muscles of the neck relaxed. So for the hot towel, we're gonna go hamburger style. Not hamburger, this is hot dog. Hot dog style. We're gonna go hot dog style first. Make sure it's not too hot. I just tested on my forearms first before bringing it underneath. Do not allow your client to hold their head up. Don't do the work for me, thank you. Just gonna bring your hand underneath their occipitals. Lift their head up gently and just slide that towel underneath. Make sure that you don't have any type of collars or anything blocking that heat. So we're going to start off with neck decompression going up. And it's a very gentle decompression. We don't want to force anything. And just make sure you remind your client to relax their head back. Hold it for about 15 to 30 seconds. And then so make sure you don't get their earlobes going up. I like to come out and just pin their ears down. And then the towel should be right underneath their occipital. And we're going to just pull back very gently and hold it for 15, 30 seconds. Then that's when slowly rotate, making sure the towel's nice and flat. bringing my hand right behind their skull. My first thing that I do is a small rotation, and then we're going to do a flexion. Small flexion and rotation at the same time. What I'm feeling for are just sticky points in the rotation and flexion of the neck. Just take your time. Allow your client to relax in this position. Don't hold this position for no more than 15 seconds. I switch hands. I grab the other part of the towel. Just gently bring their head up. Release. Do the same thing on the other side. Your edges are fine, so I'm going to take this up. Okay. Okay. And then you just slide that towel right out. Now put it to the side. Now for neck stretch, first, we're going to mobilize the cervical spine. So this is where I bring my thumb, and I'm pretty much going to the first vertebrae I can get to in the cervical spine. So bring it to right here, pretty much where the scalenes start. And then just make sure that they're relaxed because this is mobilization. My other hand, the palm of my hand is on the opposite side of the occipital right here, and I'm just going to laterally flex into my thumb very gently, and then I'm moving my thumb up to the next cervical vertebrae. I'm not pressing too much into the vertebrae. This is just a mobilization. This is not a muscular release.
That literally feels like a drug. Like, it's so good.
So to show you, this is what my other hand was doing. It's right here. So as I laterally flex the neck, I'm just sliding. You're good. Going to lateral flexion of the neck. She has pretty good range of motion in this. But you can bring your forearm, bring it right in between that shoulder joint and the pec major. The help kind of open up the chest also.
I felt that.
You can add a PNF cycle here if you want to, if they have limited range of motion in lateral flexion. If not, just go on to the next side. This side has a little bit less range of motion. So we will be adding a PNF cycle or two into this one. I'm just cupping the back of her head. I'm always in contact with her neck. Bring that forearm right there, and I'm going to bring my upper arm onto the side of her face. Then what I want you to do is bring your ear to your shoulder. Hold it. You want to hold that for 5 seconds. Let it go. Nice, beautiful. And then with this shoulder, I want you to press your shoulder up towards the ceiling. Let it go. Nice, beautiful opening up of the shoulder. We're going to hold that for another 10 to 20 seconds. into flexion, cross that arm, and my other hand is right behind the head. I'm pressing down on the opposite shoulder and then pressing up on the skull. Good. I really want to focus on the anterior part of her neck because she did test positive for the carpal tunnel syndrome. So I have a yoga ball. It's kind of flat and you want it flat. You don't want it all the way plumped up. We're going to bring this to the base of her cervical spine. So you're just going to tuck in your chin. I'm going to lift you up right at the base right here. Then that way we can get a full extension, not full extension, but a partial extension of the neck. Starting off, just gonna put some pressure going this way towards her feet. Just open up the chest. Put some pressure. Yeah. Then I'm supporting the head again. And we're just going to rotate and bring it down to get the scalenes and the SCM. If you want, you could put, before you bring it down, you put a little pressure on the origin point of the SCM and then stretch it. And that bad boy just popped out of me like, no. Okay. Do the same thing on the other side. It's a very gentle stretch. I'm just going to put some pressure on the origin point of the SCM. There we go. You bring it out, lift, bring out, put it to the side. For most of this, you don't have to be standing the whole time, wasting energy. If we can get as much done seated, then let's do that. Yes. So we already pretty much released the pecs. If you want to release the pecs in the supine position, just going to bring the arm right here, bring your forearm into near the origin point of the pecs, and just extend their arm out. You can rotate in and out. All right, so to start off, pretty much treating the forearm, that is really tight. We're going to add some nerve flossing, okay? So because it is carpal tunnel syndrome, really focusing on the anterior part of the arm, I'm just going to bring my fingers, I'm sorry if I'm sweaty. I'm going to bring my fingers into your hands or in between your fingers. I'm just going to rotate the wrist, get some mobilization in the wrist first. And a really good way to start off the nerve flossing is that you're going to flex and then rotate. And I'm just going to I'm just going to do a full range of motion. I'm bringing that hand in, keeping the wrist flexed. I'm just going to rotate out. It's a really good way to work on the fascia. And I'm keeping the wrist flexed the whole entire time. I'm rotating that wrist. Now to do an active nerve floss. As I come in towards your head, you're going to go the opposite way. As I come out, you're going to come this way. Okay? Ready? Relax that arm for me. There we go. Bring it in. And then out. I'm going to do this about 3 times. I'll try to do more lateral. Ready? Bring back center and let's go. Flossing because it can irritate the passageway of the nerve. So I stick to 3, no more than 5 for me. Some practitioners do 10. I feel like that's just overkill. It's overkill. So we can do some muscle release. So start at the origin point, and then I like to put pressure pretty much on that first knuckle of the thumb, and then just do a pin and stretch right here. As I go down.
Feel that. God.
Now we're pretty much in the tendon. Keep that pressure. As we get all the way to that first knuckle, it's going to be more and we're going to bring those fingers into flexion, but I really want to focus on her thumb. So I'm going to put some pressure on the thumb, bringing it back. And I want her to do a PNF cycle, pressing her thumb up towards the ceiling. Let it go. Ooh, that was a good opening. Press up again. Let it go. And we're doing this finger. Press his finger up. Let it go. It's that middle finger. He goes ready to press too. Let it go. See, that's what you get. That's what you get. Press this finger up. Yes, let it go. Press that pinky up. And let it go. And then one last stretch, but it can actually help relieve some tension off the ulnar nerve. So we can bring that thumb in, bring your fingers in. I'm just going to grasp your wrist, and then bring it into flexion. And I want you to try to open up your wrist for me. And let it go. I said try.
Yeah.
I know you wasn't going to be able to. And then you can add some circular rotation, just to shorten the anterior part of the arm, the forearm.